Nagpur, 25 to 27. She's holding this post right now. She was the vice president, Nagpur Obstetric and Gynec Society in 25-26, organizing secretary, EZCON, 2018.
Fine. We are already running short of time series there. So it's okay. Thank you. So should I?
Welcome,
So,
ma'am.
yeah. Very good morning to all. So I bring greetings from Nagpur, and my topic is acute sports and exercise-induced injuries in menopausal women. And today we have started our day with wonderful Kaushalya Mata Mandir and yoga. So really congratulations to the organizing team for being so thoughtful. So why this topic is important? This is important because now women are exercising more often. They have become more alert, and lifestyle modification has come into vogue, and people are going on more gyms and more swimming and more trekking and more cyclists. So, since 2 days we are listening about menopause. So, how it affects musculoskeletal system. So, there's decreased bone density, there's risk of fracture. Muscles also show sarcopenic changes. They become less stable. Tendons, the collagen is reduced, and therefore the quality and elasticity is increased. Therefore, it leads to more taunting. Ligaments, they become less elastic and easy to be torn. Cartilage also become thin and loses resilience, increasing risk of osteoarthritis. And similarly, the recovery is also delayed because we have sleep deficit, then inflammation is there, and so the recovery process also goes on slowly. Now, why the menopausal women are more prone for injury? Because of decreased estrogen, there is a deficiency, and which leads to the changes. And muscle strength is gone. The neurocognitive and neuromuscular responses become weak. They are more prone to fall. This reduced stability, impaired balance and posture control. Therefore, there are high risks of being women falling even while doing exercise or even in the local daily course of life. And they're more prone for fractures, which adds to the problem. So, false statistics say that 1 in 3 women after 50 years of age falls annually. And these figures that every 20 minutes a elderly woman is seen falling, and how it adds to the disability and all the burning issues related to menopause. So, why are we more prone to injury? We all know about this. We already talked. Now, these are the common injuries which are encountered by women during menopausal age while doing exercises. It can be muscle strains, it can be ligament sprains, it can be tendon injuries, it can be meniscal tear, stress fractures, or fall related fractures. Now we'll go one by one. Most common is we get strains, we get calf, there's pain or there is tightness, hamstring, but there are band formation, there's pain and chronic backache. A few days back, I went to one physiotherapist, and there was a big board written in consultation. Backache is common. Don't ask the cause. Don't ask the duration. When will it go? And it is, unexplainable how much physiotherapy you do, how much calcium you take, how much vitamin D you take, but a backache comes and go, comes and go. It keeps on hitting. So one more reason is if you have a poor warm up, or if there is sudden or prolonged exertion. Then ligament sprains. When the ligaments become more elastic, so their mobility is reduced. They become more plastic type of thing. And when you overdo, so there are chances of ligament sprains, especially in ankles and knee. And if there's sudden twist, it can lead to fall, or it can lead to injury causing tear of the ligament, which will require long treatment. Then tendon injuries. Achilles tendinopathy is so common in menopausal women. Even not only exercise induced, even more walking can lead to tendinopathy, and it can lead to plantar fasciitis. It can lead to calcaneal spur, and that pricking sensation in your sole is very distressing. It takes long time to go. So one more thing, you have to wear very good footwears, very friendly footwears. And thanks to our Foxy team who have brought in, sari with shoes, sari with, which is adding to our comfort. And we see so many of our colleagues flaunting shoes with the saris, sneakers. Now, then there are fragility falls, which can lead to fractures in wrist, vertebra, or hip. Yeah. So, which sports can lead to all those injuries? So, we have to be very cautious by selecting the sports at this stage. Running, tennis, badminton, pickleballers come in nowadays, trekking, weight training, and Zumba. So, they don't say don't do it. You have to have proper trainer. You should do the proper technique. You should have proper warm up, and you should go for the exercises. What are the red flag signs? Whenever you are having inability to bear weight, sudden swelling in any joint or any body part, severe backache, some neurodeficit in some area, maybe some injury or some ligament or some nerve is entrapped and that's causing pain. It can be some injury somewhere. Very common thing seen is tennis elbow, and we gynecs are very prone for tennis elbow because we overuse our right hand, writing, extracting baby, sonographies, laparoscopies. So very common in us, and along with that, weightlifting. If you are not doing it properly in proper alignment and gradually increasing the weight, we should not come down, but we should do the things gradually. So warm up is very important. It improves flexibility, it enhances coordination and reduces strain and sprains. So 5 to 10 minutes warm up before exercise is very important. Now this is the exercise pyramid which you all know. How should we have a distribution of exercises in a week? And we have to do all type of exercises. There should be aerobic, there should be walking, there should be strength training, there should be balance and resistance training exercises. So what are 5 P's of preventing injuries? Proper warm up, progressively load the weight. You have to do weight training, protein, of course. In and out, we talk about protein. Pelvic floor training. Whenever you are doing any exercise, tighten your core. If you tighten your core, it is going to prevent you from injuries and it makes your core very intact. It makes your pelvic floor very strong, so it can prevent futuristic problem. Now, this is a 52-year-old woman, persistent pain in shin. So there are, spontaneous fractures in shin bone. So we have to be very alert about it and we should not neglect them. A patient supports injured arm with opposite hand and she will be having severe pain, some visible deformity, some flattening of shoulder. So what it could be? So shoulders are very prone for shoulder cuff injury, dislocations. If you fall on the outstretched hand, there can be dislocations and fracture of femur. Simple fall can result all these problems. ACL again, anterior cruciate ligament in the knee. It's very prone for injury. It stabilizes the knee, but it prevents excessive forward movement and rotation of tibia. But how it occurs? Sudden twisting movement or rapid change in direction or jumping. When we, I had middle meniscus tear after a banquet. I danced so much that it led to the tear of the middle meniscus. So jumping and dancing for a long time also can lead to that. Slipping and falling, of course. Now, ACL tear may not be most common injury in the menopause, but when it occurs, it can be life-changing, often leading to prolonged inactivity, weight gain, and it accelerates bone and muscle health. Resistant training, again, the game changer. It has to be done 2 to 3 sessions in a week, and it has to be again a gradual shift of weights. Now, if there are injuries, some very important basic things: rest. We have to give time for recovery of the muscle or the tendon or the ligaments which have been injured. Ice application. Whenever there are acute injuries, they say to use ice packs or cold fermentation. It helps to relieve immediate inflammation. Physiotherapy, strengthening exercises, and counter force bracing. If I have here shoulder dislocation here, so they brace it in such a way that the opposite shoulder is not overused. Even for the tennis elbow, what I noticed, I had a tennis elbow. So I was using more of my left hand. So gradually I started realizing up to left bhi jayega if I do it. So we have to do a counter force of other side also. And then there are PRP injections, shock wave therapy, and of course, last surgical management. As a gynecologist, we should also know about stress urinary incontinence related to exercise. Some people do harsh exercises and they can land up into pelvic floor dysfunctions, prolapse, worsening, and JSM related discomforts. So we have to train them for pelvic floor exercises. Yoga, the last slide. So yoga has many benefits. It has mind and body, soul is rejuvenated. What is not allowed is do proper training for yoga, get yourself trained. Moving to a quickly without warming up can lead to problems. Trying to match someone else flexibility can cause problem. Ignoring warning signs can be problem. Practicing without guidance can lead to problem. Otherwise, yoga is better in causing injury, and there are very less injuries. Only most of them are in wrist extension. When you do those namaskar, your body and the joint should be aligned. Ankle and knee joint in the same line, wrist and elbow at the same line when you are doing the yoga practices. So exercise smart, protect bones, muscles, and pelvic floor. Prevention is better. Maintain good posture. Use good accessories for exercise. Good shoes, good accessories, so it will prevent you. Thank you. Keep yourself challenging, but keep one thing in mind: we are aging, so we can't do the same thing which we were doing 10 years back. But keep on challenging and have a healthy life. Thank you so much.
Thank you, ma'am. Thank you so much for telling us how exercises